Okay, so it's a little bit after 2, and I'm Joanne Osborne. I'm a former state representative and had been your chairman of Health and Human Services. I'd like to thank the Arizona Center for Civic Leadership for inviting us to be here today, but I'm also a Flinn-Brown Fellow. So hello to all my fellows out there. It's great to have you with us. And it's a very special day for us because we're talking about teen mental health and the ad hoc committee that was put together a year ago. So I really do appreciate this time. Just as a little bit of background information, I was asked about a year ago by the then Speaker of the House, Rusty Bowers, to put together an ad hoc committee that was on teen suicide. There had been an uptick, unfortunately, in teen suicides in the East Valley, and he'd been hearing from constituents and a lot of concerned parents about what should we do, what can we elevate the talking over this problem. And he came to me and asked me if I would chair this committee. And I told him, I said, I'd be honored to. This is truly a passion that I have for teenagers. And I think that this is something that we can really, come to the table with hopefully some solutions. But I said, Rusty, unfortunately, suicide is the end game. We are really needing to talk about what happens before that. What comes into a child's mind that they decide they need to, escape and commit suicide. So I asked that this really actually be on teen mental health. And then I went to work, and I call it my ecosystem, our team of 20 members to this committee. And it was really about all the different voices and the perspectives that people that deal with children. And I want to say probably of the 20 people, maybe 19 of them all had kids. So we were all parents and knew that this really is something that we cared deeply about. So I'll tell you a little bit about what made up those 20 representatives on this committee. And 4 of them were legislators, 2 Republicans and 2 Democrats, so it's bipartisan. We had a psychiatrist. We had 4 members that were from the public, but they were advocates on teen mental health issues. We had 1 member from the behavioral health provider community. We had 1 that represented a nonprofit. We had 1 that represented as a school counselor. We had 1 that is just a parent. And like I said, even though we were all parents, this person was strictly looking at it as a parent's point of view. And we had someone from a rural area. We had a pediatrician. We had someone from a behavioral health facility. We had a pastor, so our faith-based community. And we also had a school resource officer. After the committee members all came together and we had our first meeting, we talked about breaking up into working groups. And we had 3 working groups. One was on family support and substance abuse. The second one was on access to care, mental illness, and depression. And the third one was on bullying and social media. We all know we were all teenagers at one time. And, the teen years are tough. We all know that. There's issues of hormones and depression and acne and geez, the guy sitting next to me is so cute. Should I send him a note? We had all those things that went on when we were teenagers. No different than what teenagers have today. But we didn't have back then the issues of technology, of social media, and things that last out there forever on platforms. We also didn't have to deal with a pandemic and school lockdowns. So even though children are resilient, some of them weren't quite bouncing back as quick as they could. But we heard from nonprofits, we heard from government agencies, we heard from youth groups, we heard different reports and data as a committee, and then the working groups all went to their own groups and they talked about everything that we were hearing and learning. And collectively, we all came together and we had 23 recommendations. Now, of all those recommendations, that doesn't mean everybody agreed with every recommendation. But that was the point of solution, and finding, what collectively we cared about and what was important. And I have 6 of my committee members here today to talk about some of those recommendations. But also the things that we were hearing was the most up-to-date information and data that was out there. And by the end of the 6 months, there was brand new numbers. And luckily, it looked like it was going in a positive direction for kids. So that, I want to make that clear, that was good. But, as we were looking at this, there was question on what is the true, when you look at fatality reports, when you look at the data of what has caused children to die or teenagers to die. And we thought some of the things that was said was that it looked like it was suicide. But I think that it really was accidents, whether it was a car accident or some, freak accident. But really, we're talking about the preventable deaths, the prevention to suicide. And so back to the 23 recommendations, really, that spurs on mental health and all those different aspects that our teenagers are dealing with. So let's get to our panel and our 6 different people. And I'm very excited, to see all of these friendly faces and some of the ones that I worked with. And I wish that I could have the other 19 people on here, but we'd be here for, at least a day going over all the stuff that we talked about. But I'd like to start with our pediatrician and Dr. Kirkilas. Let's hear from you. Give us a quick, kind of introduction and, your top recommendation. And you're on mute.
Well, thank you, Representative Osborne. Yes, I'm a general pediatrician here in Phoenix, and I'm very delighted for this opportunity to talk about mental health. I think if you're going to dedicate an hour of time to discuss something, there's a lot of things that you could discuss, right? Affordable housing, inflation, but teen mental health is one of the top ones because the stakes are so high. And as Representative Osborne was saying, suicide is the end result, but there's a lot of ways before that we can intervene. So needless to say, this is a really important topic. My approach to mental health, obviously, is as a pediatrician, and it's a great occupation. Teens come to me and they tell me things that they otherwise would not tell anyone else. We talk about dating and whether they're having sexual relations. We're talking about substance use, whether they're using marijuana. We're talking about behavioral health and whether they're depressed or anxious or thinking about hurting themselves. So it's a real opportunity to have a front row view of what's going on with teen mental health. My specific practice, I am limited to only seeing adolescents and children who are homeless or at risk for homelessness or at or below the poverty line. If I would say my typical patient would be a 16 or 17-year-old whose unfortunately father was never part of their life or incarcerated, raised by a single mom struggling to make ends meet. Maybe that mom had some domestic violence in her life or mental health issues, and maybe she's turned to substance use and sometimes succumbed to addictions to meth and fentanyl. So these children that I see have a really, really hard time, a really hard go at life. And one of the things that I'm competing with when I see these children is a lot of times those traumas, they're turning to substance use where I want to turn them to behavioral health. So my recommendation on this committee was recommendation number 23, which stated that 16 and 17-year-olds who do not have a parent or guardian because they're on the streets, maybe they're living with grandparents or they're couch surfing, that select group of children, that 16 and 17-year-olds, they could consent for themselves for mental health services for a short period of time, only 4 months, and at which point it would just be talk therapy and no medications. The reason this is really helpful is that my hands are tied when these teens come to me. They're hurting, I'm trying to steer them toward mental health, but unfortunately, I can't do anything about it if they can't consent for them. And so likewise, they turn to substance use. I know parental rights is a hot button topic. And so that recommendation, I think, is very specific for 16 and 17-year-olds that don't have parents that can sign for them. It's only for 4 months to get them stabilized, maybe get them off of drugs, maybe get them to a safe place. And there's no medications. So it's, everyone has different opinions about psychiatric medications. So there's absolutely no medications that would have gone along with it. And I think this recommendation goes points to the fact that there's no one size fits all approach to mental health. You know, we could advocate for more counselors, and we do need more counselors. We could advocate for more resources for parents because they're bewildered by what to do when they find out that their child has a drug problem. But in this specific subset of patients, even those recommendations, if they came to fruition, would not have as big as impact on kids who simply can't even get to the counselor. And believe it or not, homeless youth is a big problem in Arizona. I can guarantee you, no matter what part of Phoenix or Arizona suburb that you're in, you have adolescents who are homeless in your community.
Well,
so that was my recommendation.
Thank you, and I truly appreciate what you do for our kids, and especially that homeless youth population. I was actually part of the founding of the Homeless Youth Connection a long time ago, and so I do see definitely your points that you're talking about. But you know, when it comes to teens and youth in general, regardless of the subset, in general, talk to us a little bit about that issue of mental health with teenagers, because you know, for the most part, we always talk about the physical body, the physical health and what's going on, but you know, get a little more into about the mental health aspect of things.
Yeah, it's a little demoralizing as a pediatrician when I know that my contribution to their health is actually quite minimal when it comes to therapists, because by and large, adolescents are healthy. They're not dealing with all the things like diabetes yet and strokes and blood pressure issues, but they are dealing with a lot of mental health issues. And as you alluded to before, there's a lot of pressure on kids. It's an interesting aspect of their life where they're kind of adults and they're kind of kids. They're trying to figure things out, and it's stressful. And so their mental health is actually the best bang for their buck. If we could make one change, is not the physical health, but actually the mental health and helping these kids.
Got it. Thank you. And you know what? One more question before we go to our panelists. So in the a 2-minute time frame, how about the fact that you have been a champion with me on working on the issues of substance abuse, of mostly the issue of marijuana. And we also know that there's been, way before COVID, there's been issues with vaping and things like that. But in your things that you've been passionate about and working on, you know, what are some of your greatest concerns as a pediatrician out there, and the things that we were just talking about?
Yeah, so I mean, you know, here in Arizona, we have legalized cannabis use. You will see billboards with Santa Claus on them. You'll see billboards with cartoons. You don't see that with tobacco, right? And make no mistake that youth are being targeted by advertising, whether it's on a billboard or whether it's on their smartphone. And there's no laws to prevent this. And as we know, kids are hurting. A very quick and easy fix is to not feel that hurt anymore. And they're being advertised to. So I think we desperately need to make some changes on how advertising works, both on social media and by billboards, to make sure that kids aren't going to be targeted for their own mental health.
I appreciate you. Thank you so much. All right. So we are going to panelist number 2, and that is our SRO, Sergeant Tyler. So please introduce yourself and tell us about your top recommendations. And actually, you have been promoted to a new position as well. So tell us about that.
Yeah, so I'm Sergeant Tyler with the Goodyear Police Department. I was formerly our school resource officer and school resource unit supervisor for the last 2 years. Recently moved over to our community services unit. I now oversee all of our city events and our outreach, as well as all of our homeless outreach specifically. Basically anything that's community outreach is now in my world. We even crisis intervention team falls underneath me too. So I'm the one scheduling our training, making sure all of our officers are crisis intervention trained. With my background in the school, I felt that it was important to provide funding for the school districts and nonprofit organizations to have mental health first aid training, youth resiliency training, and substance misuse awareness training, peer-to-peer education. This was a recommendation number 1. One of the things that I've seen in the school setting is there's a lot of care inside of that setting. Teachers start to care for these students just like they were their own. They're very in touch with their behaviors when they're having good days, when they're having bad days, and they recognize very quickly when these students are having, when their behaviors change, whether it's they're at school or something is just not right at home. They're leaving often. They're just not participating in school often. They quickly recognize that there is a change in that behavior, but they don't know what to do when they recognize this change. This kind of gives us a more holistic approach for all the different stakeholders who see these students to better understand what they're seeing and how to approach these issues for a mental health standpoint. Like the doctor was saying, that right now we need more counselors. And I read last week that the need for counselors is going to outgrow the actual counselors by 4.5 times over the next decade. And so we need to empower people and put more people out there that understand mental health issues and how to approach them. And just like you said, the social media that our teens are dealing with, it doesn't allow them to disconnect. When we were all growing up, we could go home, close our door, and we didn't have to contact the outside world. Today, that phone is attached to our hip. Facebook knows it, Instagram knows it. When somebody likes something, when they send you a message, when you haven't been on their apps for a long time, they send those alerts to your phone, and it's instant gratification. We never had to deal with this growing up. If we had a bad day or someone said something bad, we could go home, turn on music, and disconnect from everybody outside our four walls of our home. The SRO role is even, a lot of people think that it's law enforcement. That's not why we're in schools. Our schools we're in the schools to provide a possible positive role model for students who don't have them at home. Our SROs, just like any teacher, take an investment in these students, and they recognize the same thing. And a lot of these students go to our SROs with some of their problems. Our SROs have been trained in mental health first aid and CIT, and they're able to help these students before any teachers could, but they're not comfortable with the SRO. Why would we have some very easy training and not provide this training to the teacher?
Well, and I appreciate that. And I believe that, I think that was recommendation 1 or 2,
Yes.
that you're, with the first aid training. But we had identified that, the state of Arizona is receiving opioid settlement dollars, and it's quite a large sum of money. We had recognized that there were things that court-ordered dollars could be spent on with teen mental health. And part of that was what you just said. It was that first aid training for teachers, because not every teacher has had that first aid training within their schools. And to your point of, arming them with the things that they need to be strong, for the parents, for the families, for the kid. And that's what we want to see is helping each other, because you're right, there's not enough counselors out there. There's not enough pastors out there. There's not enough, it's taking a lot of people to recognize when someone, when a teenager is hurting. But I'd like to ask you, with your SRO hat on, what were you experiencing in the high schools, especially when it came to the substance misuse and things like that? What were you seeing?
It's definitely out there. One of the, I had never seen it out when I worked patrol. We had students who took edibles, and these, like the doctor was saying, these edibles look identical to the legal version with no THC in them. The only difference is in a small corner, very, very smaller than a penny, it says THC in it. So as an adult, unless I'm looking, I could have taken that myself. These students got a hold of it, thought it was candy, they took it at school. And this is a whole thing that we had to deal with. And unfortunately, there was no crime committed because the doctor was saying our law just hasn't caught up to what we're seeing out here in the general public.
Well, I thank you for everything that you do out there for us, that you've helped with the kids, that you patrol every day, and what you're doing for the community. We truly appreciate your perspectives. And I thank you for being on the committee.
Thank you.
All right. Let's go to Shelley. Shelley was our connection to the rural community and specifically Yuma. So we really appreciated having you part of our conversations and making the trip out to the Capitol. I really do appreciate that. So can you introduce yourself and talk about your top recommendations?
Yes, thank you so much and good afternoon. And thank you for allowing me to be here today and to be able to serve in this capacity. Like Joanne said, I'm from Yuma County, and we are in a unique position right along the US Mexico-California border. And so we have some unique challenges being so close to those borders. My family, myself, my husband and children were all raised in Yuma County and educated there. Just a little background about me. I have an insurance. My day job is insurance, and our family also farms with Mellon Farms. But I serve in a couple capacities that I've been fortunate to be able to do so in, and really it's about me learning about all the things that exist in our community and the challenges that we have, and how together as a community we can collaborate and make strides in combating some of these challenges. So I serve on the Yuma Anti-Drug Coalition as chair on the governing board for the Yuma Union High School District, which is 7 high schools, 11,000 students. And then I also am on I'm on the board of trustees for the Yuma Regional Medical Center Foundation, which I also chair the Suicide Awareness Committee. So with that, in learning of all the dynamics of our community, I have several recommendations that I have listed here. So I have number 6 and number 18. So number 6 and 18 are similar. It's the 6 is the mental health first aid training and substance misuse awareness training, and the peer-to-peer education, which I want to go into also about. And then the number 18 is the also the grant program which provides funding to the school districts for youth resiliency training and also mental health first aid training. So our community and district, and the whole healthcare system, we have found that the most effective way to impact our community and our youth and our students is the peer-to-peer engagement. And so with the Yuma Regional Medical Center Foundation, the Moore family, and our high school district, we began the Yellow Ribbon Project, which initially the Yellow Ribbon Project, we brought in people out of the program out of Colorado. After Columbine, this program was initiated and began. And so we were able to train several of our school districts. We brought our law enforcement and other people that engage, in regards to suicide awareness. But as we talked about, it goes into so many areas. You can't just talk about one without going into the mental health part and then the coping mechanism that youth use and adults use, in regards to substance use. So we were able to train our districts and our community and the youth and the students. And so the students at each of the high schools have initiated their own program where they focus on peer-to-peer engagement and advocacy. And so one of the high schools that was highlighted, and they came to the Capitol and they presented to our ad hoc committee. They also presented to Southwest Arizona Town Hall and Arizona Town Hall. They presented their program, and with their program, they make it very engaging. It's a lot of energy, but then a safe place for our students to be involved. And so they'll put on, different things to welcome students and to just bring, a lot of it is awareness and facts that they want them to know. And, the things that they have that camaraderie, and they know that they can go there and help to advocate for their fellow students. And so one of the things that they discussed when they shared with us at the Capitol with the ad hoc committee, it was what they were experiencing. We knew that when we went through COVID, the impact that it had on our schools and our students, that they when they weren't in school, we knew that they were facing so many different challenges in regards to mental health. And so now they're back in school with the addition of all the challenges and recuperating from the trauma that they experience. And so one of the things that they quoted, and I'm going to quote them, they said, students across the district experience trauma in various forms, including but not limited to death, abuse, substance misuse, homelessness, and much more. And so the students were sharing also that wanting to make us recognize what Dr. Kirkilas just also mentioned is that not all families are the same. Not all students are the same. Not all students have the support systems that some do. And so when we think of these ways to face and to address these issues, sometimes we can get in a little bubble and say, well, this is not happening here. But that is also, untrue. I mean, it affects every economic background. And so but we also need to consider those students that don't have the same support. Just for our students, I mentioned that we have, around 12,000 students. And of those 12,000 students, 90% are minority, 18% are migrant, 10% special education. And Yuma County School Districts educate 85% of Arizona's migrant students. And again, with being on the US-Mexico border and with fentanyl so easily accessible to our students, there are a lot of different dynamics that we are looking at and needing to be proactive on. So peer-to-peer approach to reaching all students has been a successful program. And I think it's an example that could be used across the state. I mean, a student will listen differently from, between their parents or a friend, sharing the impact and how much they care about them and that they are supported and should not participate in these other activities, or that they know that they have the support and that they have a friend. So one of the other things that I know that we discussed is the ratio of how important it is for additional social workers, which we're already appreciative, and counselors and SROs. So our ratio for social workers is 1 to 1,200, and the recommended amount is 1 to 250. Counselors ratio at our schools is 1 to 370, and it should be 1 to 250. And again, I think if we recognize those and how we're going to recruit people to go into wanting to be counselors and to expanding the district's capacity to be able to hire additional support. The mental health first aid, which is also recommended, which is the students can participate in all staff. Our district, we're at 99% of all staff that have been trained. And I think we've had a dramatic impact because of that additional training. And I think that could help, other districts as well. So those are some of the things, as I'm trying to go so fast because I had so many things I wanted to cover, but it was, the peer-to-peer, additional social workers, and counselors. But also we talked about having a prevention specialist. That is in recommendation, I believe that is in recommendation 21. And that would be someone that their whole purpose was to focus, where counselors are trying to do college applications and classes, and social workers, are working on, you saw the ratios of what the social workers are, but if we could have a primary prevention specialist on the campus that they were educating, working with the peer-to-peer, like they would be engaged with those peer-to-peer groups to help make them even more a dynamic and have the necessary tools that they need to be able to speak to their, their friends and everything. So those are my top. I did real quick, number 22. 22 is more access to substance misuse, inpatient and rehabilitation facilities. Being in a rural area, this is such a struggle for us. Our families can't afford, there's already a limited amount in the state. And then this is rural, all of rural Arizona, to try to be able to take off work or be able to travel and be with your child, to be able to go to mental health facilities or substance use detox facilities. And so one of the things that we've done in Yuma County is Arizona Western College and Yuma Regional Medical Center have joined together to create a behavioral health facility and a behavioral health residency program, because we know that we have to grow our own or attract other providers from across the country, which the whole country is facing the same challenges. But I think Arizona, if we could work on having that access, not only in Phoenix, but in other areas, whether it's telemed or other ways to be able to do that. But we do need a more equitable access to care. So those are my highlights. I know I probably missed something in there and I was talking so fast. So
Oh, I appreciate that. And, it was so wonderful to have, first of all, your kids from Yuma to come speak to us. I think we had 3 different groups, right, of teenagers. Yes. That came and spoke, and they really said to us, hey, they were thrilled that they got to have their voices heard. They wanted to hear what they were thinking, and that they appreciated that. It was also funny how they spoke about what we think of as adults, as to what things, whether it's certain platforms, social media platforms, they're not on, they don't look at, they don't think of. We're talking about different marketing and approaches. Yes. Help give kids information. They're like, well, I'm not on that.
Where don't do that?
So where are the kids? But we know the drug dealer, we know the bad guy knows where their certain platforms are. And so that's something that, adults have to recognize. But
can I add one to that? Sorry to interrupt. Can I add to that? I just learned this the other day through like I say, it's always a learning curve for me. Is we held a fentanyl forum in Yuma County. Our mayor hosted that with us, and the Snapchat is that you can go on Snapchat and there's a whole menu and you'll have whatever you want delivered that day to your front door. And I guess I didn't realize, how accessible, like you said, because as you mentioned, the social media, and that is what they're using. So you are 100% right. It was very enlightening to hear from them as well.
Understood. And that I hate to hear that. And that's what we're dealing with. And that's what they're dealing with, right?
Yes.
You mentioned, I was going to ask you the question about what you think. So 2 things. I mean, I love that you brought up the prevention specialists. There again, that was an item that we thought, especially for school districts and rural areas, that because a larger school district could have one prevention specialist that made sure all the teachers had the first aid training, made sure references were on the school website, made sure that, some of the peer-to-peer groups were happening, overseeing that. Because we don't have enough counselors, because we don't have enough, resources, they could help fill some of that, but especially for rural areas as well. But you kind of hit upon what I think, well, I was going to ask you, what could the state of Arizona be doing to help the rural areas? And you really hit upon what you guys are doing with behavioral health, mental health, within growing your own, with the hospital, with the collaborations and partnerships. And I love that you brought that up, because, Yuma is definitely showing a lot of things that other areas could, jump off of as well and try themselves. So I appreciate that. All right, it's 2:36. So let's hit Gina. Gina Godbehere, are you there? All right. Can I hear you? Say hi. Nope, I can't hear you. Say hello. So, nope, can't hear you. You know what, Gina, go ahead and do what you did before And we'll go ahead and go to Kristina next. Why Gina gets back on. All right, thank you. Hey, Kristina.
Hi.
All right, so Kristina is our school counselor that was on the committee. Go ahead, please, and introduce yourself and give us your recommendation.
Oh, thank you, Representative Osborne. I appreciate you having me here. So my name is Kristina Guy. I'm a school counselor. I just finished my 20th year in education, 11 of those being a school counselor. I'm a 4th generation Arizona native. So I've been here. I've been on the West Side for all of my career though. So definitely a West Side girl. What I recommend as far as our recommendations that we came up with, number 16, more certified school counselors on campuses, I think is a must. As we're talking about what Sergeant Tyler said, everybody else has kind of said about that mental health first aid training for all teachers. As they start recognizing students are struggling, we want to make sure that there's somebody on campus that teacher can get them to safely, so the teacher can keep teaching, keep doing their job, and make sure they're taking care of the other students in the classroom. So it's really important that they have somebody to go to with that. Also making sure that those are the people that serve all students. You know, a school counselor is responsible for serving all the students in various capacities, where some of the other positions might see kids in crisis or different lower socioeconomic, different resources. And so that school counselor is that person to see all students. Right now, our ratio to school counselor in Arizona for elementary schools is sometimes 1 to 1,200, and they're even switching schools. So that school counselor is not able to effectively, help those students. In those younger grades, that's where they're learning the coping skills, the resiliency skills, all of those things that we're seeing that our older students aren't having right now. So it's really important to get those certified school counselors in schools, but more specifically, adequately at that elementary school level. The other recommendation that I have that Shelley just spoke about was the primary prevention specialist. This is so key to helping school counselors, to helping teachers, to helping administrators, to helping parents, making sure that we have someone who is that mental health first aid as a trainer that can train that staff member to keep it sustainable and keep it going year after year with new teachers, new counselors, new administrators, working with nonprofits and organizations to bring resources to our parents so that they can help their students, help their children get the help that they need. Be that one coordinator person for the district, for the region, however that works, to make sure that everybody has the tools they need to do their job, to help children, to help parents help their children.
Well, and I truly love the fact that you spoke about parents. I'm a mother of 4, grandmother of 4, and I've mentored over 400 teenagers myself. But as a mom, I certainly believe that parents, it's got to be parents' rights, parents, helping their kids. But we also want to make sure that parents recognize the signs and that parents have the resources that they need, because that comes first. Tell me about, especially as a school counselor, there's been a real push-pull about parents' involvement, because we want them to be involved. That's the key right there. We want them to be involved, but you also recognize those signs. So how do you partner yourself? How do school counselors partner with the parents?
Well, I think you nailed it on the head. It has to be a partnership. We are like, the parent is the lead actor and we're the supporting actor, in the movie of their child's life, that we are here to help guide towards information, support with resources. Sometimes parents don't know where the resources are, and that's up to us to help them with that. I've had conversations where parents come to me and they just say, I don't know what to do anymore. Can you tell me what to do? I'm like, well, no, I'm not going to tell you what to do, but we'll walk you through the situation. I'll give you some resources, and then, go home and make that decision as a family of what's going to best serve your student. I also have parents that come to me that they've been talking to me for a while, and they're just at a loss because they have called a counselor because their kid is in crisis and it's a 5-month wait. And they come and they say, I need more resources. I don't know what to do, and we have to direct them to their insurance. What is their insurance going to cover? Direct them to the community resources, direct them to what's available. But when a parent comes to you and says, like, I can't wait 5 months, my child is in crisis now, that's where it's really important for school counselors to partner with those parents with those coping skills, the resiliency skills. Sometimes parents need those too, right? And so making sure that we're not there just to support parents supporting their kids, but we're there to support parents as well, because maybe they need access to information for themselves before they can help their kid. So it's really important. I'm the assistant chair of the Arizona School Counselor Association, and that is our platform, that we are here to partner with parents to make sure they are getting the information and the resources they need to make the decisions for their children. They entrust their most precious asset with the choice that they choose with the school they send their kid to. And so it's really important that we are their partners in this game.
Well, thank you. I appreciate you and being a partner, and I'm so glad that you're on with us today. We are at 2:42, and I'm trying to think of everybody's time out there. So let's see if Gina's back. Are you back, Gina?
I am. Can you hear me?
Hey, I can hear you too. All right. Very good. Okay. So Gina, you were on our committee as a CEO of a nonprofit, but you also are a prosecutor. So tell us a little bit about yourself and then your top recommendations.
Thank you. And I apologize. I had to jump on my phone because the computer just kept dying on me today. But so much for being here. It's not part of this committee. And I am the CEO of Speak Up, Stand Up, Save a Life. We hold a conference once a year at Grand Canyon University where we have about 5,000 students and parents and teachers that attend. And we try to teach the universal warning signs that a child can be in crisis and inspire kids to ask for help and teach them how to access care for themselves and for their friends. And then we try to connect those resources to the schools and the families and the students. I started this not because I wanted to go in the nonprofit realm. I am a prosecutor. I've been a career prosecutor for 26 years, and I attended, unfortunately, every time there's a murder across this county, we respond to the scene. And I responded to the scene of a tragedy at a local high school. And after the murder, it was a murder-suicide of 2 young girls. And I'm a parent, like you said, we're all parents. And that bothered me because in the days and weeks that followed, we noticed that tragedy, like every tragedy across this country, every school shooting, there were missed signs on social media and nobody said anything. So we got together as a community and we said, how can we change that? How can we inspire kids to notice that their classmates may need help or they may need help, and how can we connect those resources to them? And that's how Speak Up, Stand Up started. And that's why it became my passion from the beginning to be in the part of the working group for the substance abuse one, and why I championed the hub. And the hub was our general recommendation number 4, but it was also under the family support and substance abuse sections 17, and I also love section 19 that I'll touch in. But the reason I became so focused on the hub is we told kids from a young age, mind your own business, don't be a tattletale, snitches get stitches. And if we inspired these kids to speak up, then we had to provide help from them. But how are we going to provide help if we don't know where to send them and there's not help available? And that's what we noticed more and more, from schools to, I think it was almost by plan that I should follow Kristen talking about the issues in the schools, because the schools don't always know what resources are out there. And we found parents, if you need emergency care, there's help out there. But if you need care and your child is just at risk, but they're not at that moment going to conduct suicide, you have to wait up to 5 weeks. Who could wait that 5 weeks? What other resources are out there? And sometimes there's great free community resources available, but nobody knows where to turn to. Nobody knows what help to get. There's help for substance abuse. We talked about if somebody needs to get an inpatient treatment, it can be up to $10,000 and there's limited beds. So where are you going to send your child in the moment, even if they have that issue and you've identified it? So we, with the hub as a committee, talked about all these challenges and lack of resources, and we wanted there to be one location And we thought consistency was important. Does the Department of Health, does the Department of Youth, Faith and Family, which organization has it, and make sure that we're all connected, all the resources are there, add the nonprofit free resources that are in this community. So when families know and they have that issue, they can immediately go to one place and get the help they need.
Well, and I like what you said about the consistency, because, you know, a pastor may not, and he may be looking for resources for a family in his congregation and may not exactly know where to go, but he knows, you know, the youth, family, faith-based department under the governor's office. And so they would go there instead of thinking, oh, I need to go to the Department of Health. A teacher might immediately think of going to the Department of Education and not the Department of Health. And so we wanted to make sure that those resources, the hub, may be taken over by one agency, but those same resources is consistent across all the different departments, where people can find what they're looking for in whatever, you know, realm their life is in. And I love that you brought that one up. Thank you.
And Joanne, if I can, one of the things I could tell you is I tried with Speak Up, Stand Up, Save a Life to create a hub. And I personally went out and met with CEOs and of all of these nonprofits and tried to connect them together. But I can tell you it's a lot of work. It's a lot of vetting of organizations, and being that my organization was just a volunteer group, we didn't have the capacity to do it, and I couldn't find that list of resources anywhere. And so that's when we talked about using the opioid settlement money for a good purpose, or have somebody hire somebody who can vet organizations, who could add them to a resource, who could use that to connect families, connect schools, connect ministries. I knew place to go, and everything from, I mean, we talked about including free and discounted legal services that the state bar has, housing issues, and also the bullying, the suicide, the mental health, substance abuse. We're talking about connecting all these resources these families need in a time of difficulty. And even so much when you talked about COVID, we had stepping stones of grief. We have organizations dealing with grief counseling that can help families when they need it, but nobody knows that they exist.
Very good. Well, now I want you to, lastly, a quick question. So you were there as our nonprofit. You were there talking about your very important organization that I love what you guys do. But I want you to put your prosecutor hat on. And, you know, because that's the other side of life, when someone's been making wrong choices, right? And tell us about how you feel about, we got to get them at the early age, back to the teenagers, back to that, you know, because you don't want to see them at the other end. So talk a little bit more about that.
Thank you. You know, in my career, I was not just a prosecutor, I was a violent crime prosecutor. And I have prosecuted some of the most violent criminals in our community, from murders to armed robbery, home invasions, ag assaults. And I noticed something. We were focusing on, we're not focusing on prevention. We're triaging a problem. We're at the back end. And in my job, it was putting away people to protect the community. But what I noticed in that capacity, when I reviewed a mitigation, you can almost pinpoint a time somebody went right and should have went left. And it left that question, what if we intervene early? Could we have prevented this tragedy that's playing out in our courtroom today, this awful homicide, this awful sexual assault, if we had just intervened? Because a lot of these people that commit the crimes, they had trauma in their childhood that went unaddressed for decades. And a lot of them, the same pattern is not only sometimes trauma, but also mental health, and they self-medicate with illegal drugs. And when you medicate with illegal drugs, you end up a group that's high risk to end up in our homeless population or criminal. So when we're talking about community safely and protecting everyone, why aren't we talking about intervening early, getting help, and trying to divert that at-risk group from our criminal justice system and our homeless section? And that's what I'm passionate about, because I believe in that early intervention. I believe in what's happening, and look around, our homeless population is getting worse. Our substance abuse issues are getting worse. If we don't intervene early, and like all the other panelists talked about, do something to negate the message that drugs are harmless. They're not harmless. drugs are setting them off on the wrong path. And especially when they mix it with mental health, those are what we're seeing in the criminal justice system, which goes back to why we need to intervene early. And to intervene early, we need to have the resources out there, and we need to give that treatment to help them so that we can save lives now, but also save lives in the future by preventing these tragedies.
Well, thank you. And in a convenient hub, right? those resources. All right. Thank you so much, Gina. Okay, Pastor Ryan, let's have you bring us full circle here and introduce yourself and tell us about your recommendations.
All right. Well, thank you so much for having me on. And this whole process was incredible. I'm a pastor of Palm Valley Church in the far West Valley. We serve kind of the Goodyear, Buckeye, Avondale area, have just kind of a large swath, multicultural, multi-generational church. So I get to see a lot of kind of a cross section of our community, and mental health is a big deal for our students, but students grow up to become adults. So I get to see kind of the whole gamut there. Now, one of the great privileges we had on this committee was to be able to hear a lot of great information from experts, a lot of great presentations. And one of the ones that really stuck with me was how one of the presenters kind of used this framework. He called it all, some, and few, all, some, and few. And essentially, when it comes to mental health, all teenagers, all of them need healthy relationships. We all go through difficult things in life, anxiety, hurt feelings, difficult circumstances, parents, trauma. All kids need someone that they can have a conversation with when they're hurting. That could be a school resource officer. It could be a friend. It could be a teacher or a counselor or a parent. Everyone needs a person. Some of them, though, need professional help. They need professional counselors. They need mental health workers. They might need to sit down with a counselor for an extended period of time. They might need medication from a doctor. Some people fit in that category. And as a pastor, I spend a lot of time trying to destigmatize that it's not, I would say it's not a sin to be sick. We have no problems if you have a problem with your heart or with your lungs to go see a doctor. Hey, if you're struggling with your mental health, go to your doctor, get some help. Some people need that. But then a very few need inpatient help. They need extended care. And that's why I was really big here on our recommendation that there needs to be more access to substance misuse inpatient and rehabilitation facilities for kids, adolescents across the state, specifically in rural areas too. So as a pastor, I felt this. I felt like there weren't enough facilities, but a feeling is not really research. So we picked up the phone. We went on to findtreatment.gov. You can actually put in your zip code there, and it lists all the facilities available. So in the entire West Valley, there were 9 facilities that came up on this. So myself, my assistant, we started calling them and asking, hey, do you have room? What does it look like? How much does it cost? Of the 9 facilities, 2 of them had closed. So they were gone. They left during COVID. Only 3 of those only accepted adults. So adults only, no students. 1 never answered the phone. They were just unresponsive. So of the 9, we're bringing that down to 3. Only 3 of them took teenagers. 1 of them was cash only. So if you don't have cash to pay for it, you're not getting help there. 1 took private insurance as well as Medicaid, and then 1 took Medicaid, cash, and private. So really, if you were struggling financially, only 1 of those would have been available to you. There is a scarcity of this, and that's just a snapshot here in the West Valley. This is more pronounced in rural areas,
Sure.
all of the state here. And that's why I recommended that this is something we need to invest in. We need to provide a way for there to be more access to these types of facilities.
Well, and I really appreciate that you're saying that as a pastor. I mean, you know, you want to be there for the people in your congregation, for the people of the community, but there's only a couple of you as well. I mean, you know, there's people of faith want to be able to go to people that they trust, and you're certainly one of them. But when you recognize you can't do it all either, you know,
Right.
that everyone needs the, some sort of touch point of someone to speak to. I really do appreciate that you said that, and your little journey that you and your assistant went on, looking for, what those avenues were to help give resources for people to take. My husband and I have been married for 36 years. We've had, a strong family unit. We do have our faith, and there's a lot of families like ours, but then there's a lot of families that aren't. There's a lot of single parents. There's a lot of parents that are struggling themselves, which, unfortunately then makes the family unit even tougher place to be, and to really to help children get through those tough times of a family that's disconnected or that has broken apart, or children that are dealing with parents that are struggling. What do you see in your own congregation, in your own community, that I guess has been eye-opening, or kind of, talk to us about that a little bit?
Yeah, I guess probably one of the things that I get to see is the several generations there. So we have, we have kids, we have youth, high school, middle school students, we have young adults, we have, adults, we have grandparents there. And so often when people walk into the doors of the church for help, they're going through crisis, but this crisis didn't start in adulthood. It was something that started when they were younger, something that if they had gotten the help they needed when they were in middle school, when they were in high school, it could have been avoided. We have an extensive recovery ministry. Very few of them. In fact, I can't think of a single one of them that said, "Oh, I tried drugs or alcohol for the first time when I was in my mid-30s." It all starts much, much younger, and it just the generational impact of that, because if it's not dealt with, it's affecting several generations there. So I just see it much more holistically, which that prevention, just like you had mentioned, Gina, like if we can prevent it, it's so much better than dealing with the crisis on the other hand. And the earlier we can get into those families, and what we specialize in is the relational part. We can get people connected in relationships, but I can't fix some of these inpatient facilities that when that's needed, for it not to be available in the community, man, that breaks my heart. I want us to be able to get people connected to the help they need. So we all need to rally around this.
I appreciate you. Thank you for being on our committee, and thank you for being here today. I'd like to have the whole panel come back up, and we just have a couple minutes left, but there's so much that we covered in that 6 months, and with the 20 people that were there. Is there something that any one of you want to just quickly came to your mind, you want to add real quick to Shelley? Shelley's got her hand up.
Yes, I'll be quick. Yes, just to, what Pastor Ryan was saying and what we were all talking about, I think Arizona has the opportunity to really set the pace for the rest of the nation, as in being creative and that holistic part that Pastor was talking about of approach, because it really takes all hands on decks. It really does take the clinical side to the education side to the, the creative state funding side, all of that working together. I really think that we can address a lot of these issues and support those rural communities. And what Gina was talking about, the hubs, it's hard, and as Ryan was saying this, Pastor was saying this also, is that in the Phoenix areas, you can look and maybe you're trying to navigate all those, facilities, but really in the rural, they not only need to know what they have locally, but what can they connect to, at the state level. So having that accessible in rural areas and metropolitan areas, I think would be really vital. But I think Arizona can really set the pace and have an impact. And maybe it's a mental health community coalition that really brings all those, brings the faith and the clinical and everyone together. So thank you for the opportunity. And I think we have, we really could set the pace and be that model for the rest of the nation.
I love it. I appreciate that. Kristina.
I couldn't agree more with you, Shelley, that we could really set the pace, and this is not going away. The change in students' mental health that I've seen over the last couple of years with the uptick in students who need more services, we can't wish this away. It's here, and if we don't do something about it, it has the potential to be much, much worse. So let's be the forefront in this nation and help our kids and show others, how we can get it done successfully.
Thank you so much. Anybody else? Okay, you know what? I really want to appreciate and thank each one of you today for being on our panel and to talking about the work that was done with our committee. I wish we could have everybody again. So it's great to hear from you guys. And I want to thank the Arizona Center for Civic Leadership for giving us this opportunity and platform to talk about the things that we've all come together on. And that's so very important. But you know what? I'm optimistic. I'm optimistic with our children. I know kids are strong, and we all know that, but they just need a little more support right now, and we can get there. And I think that if we keep a positive, forward-thinking face on ourselves and collectively come together, united, that's how we solve problems, and that's where we need to be in society today, is to work on those things. I hope that you all have a wonderful July 4th. And when you think about it, as Americans, it's July 4th. This is the time of unity. We're all here together to celebrate our country. And we should be, because when we are united, when Americans are showing their best, the whole world learns from us. And so we may be talking about, from our little Arizona, helping the nation and what we're talking about with teen mental health, but quite frankly, everything that we do as Americans helps the world. And I thank you, and I hope you have a great July 4th. Take care, guys. Bye-bye.